Mr. President, last week, hospital leaders from every corner of my state of Illinois came to Washington. What was the reason for the trip? The debate in Washington about the future of Medicaid. Each and every one of them, from the city of Chicago through the most rural areas of the state, was concerned about plans by the Republicans in Congress to change the funding for Medicaid. From the south side of Chicago to Macomb in west central Illinois, as well as Rockford, 20 miles from the Wisconsin border, Carbondale, all the way downstate, they came to see me. There's small, critical access hospitals in rural areas. There are safety net hospitals treating the poorest patients, and there are large teaching hospitals in downtown Chicago. They're all focused on Medicaid. All of them told me that Medicaid cuts Republicans have put on the table would be devastating to their hospitals in every corner of my state, devastating to the doctors and nurses that they employ, and especially hurtful to the patients and their families. One told me that it's the only hospital in a 60-mile radius delivering babies. If Republican plans to cut Medicaid go through, this life or death care could be out of the reach for pregnant mothers. Another safety net hospital told me they might have to close their doors altogether if the Medicaid cuts happen. Why? Why would Republicans in Congress even want to jeopardize health care and ring alarm bells in hospitals across America? They're trying to, quote, save $880 billion. Well, what is the critical need to save that? To perpetuate the tax breaks of the Trump administration for the wealthiest people in America. Yep, that's the game plan. That's right. President Trump and his billionaire buddy, Elon Musk, richest man in the world, have asked Republicans in Congress to provide a massive giveaway to the wealthiest Americans, and they want to use Medicaid cuts as the piggy bank. Let's be clear. This is not a health care reform plan to improve our health care system or lower costs for families and patients. Nope, Republicans are looking to dismantle the basic Medicaid program to help tax cuts for billionaires. Don't take my word for it. It's not just another political speech. Last week, the nonpartisan Congressional Budget Office issued a bombshell report. I'm sure the Republicans in charge of the House and Senate didn't anticipate this. The Congressional Budget Office reviewed the Republican plans to cut Medicaid and determined the only way Republicans can save money is by removing millions of Americans from this health insurance, slashing benefits, or cutting access to doctors, nurses, and dentists. For weeks, Republicans have been adamant that they're only focused on addressing waste, fraud, and abuse from Medicaid. Then comes the CBO report. I want to agree with the basic premise. If there's inappropriate spending, fix it. But that's not what's happening here, and I think the Republican majority knows it. The Congressional Budget Office called their bluff and confirmed these Medicaid cuts proposed by the Republicans are not about waste or efficiency. They're about restricting access of coverage to patients all across the United States, including my state of Illinois. Under Republicans' watch, CBO stated that 13.7 million Americans will have their health insurance coverage terminated. Almost 14 million Americans will lose health care coverage if the Republicans go forward with their plan. What is the acceptable number of constituents losing health coverage for Republicans? Nationwide, half of all rural hospitals are already in the red, and more than 300 rural hospitals are facing immediate closure, including 26 in Kansas, 22 in Alabama, 21 in Texas, 9 in Missouri. How many rural hospitals closing in their states are Republicans willing to accept to help perpetuate tax breaks for the wealthiest Americans? Let me tell you, as a person from downstate Illinois, Rural hospitals are the backbone of the community. Not only are they critical places for emergency medical care, they are the anchors of the local economy. Speaking of the economy, one of the ways Republicans plan to cut Medicaid is by imposing burdensome red tape requirements. Put paperwork in the path of an individual looking for medical care. Pile it up, make it hard. Pitched by Republicans as just simply work requirements, this policy withholds health care for eligible patients until they meet overly complex paperwork requirements. It's a failing strategy. In the states that have tried these so-called work requirements, there's been no increase in employment. The only impact has been patients who were ruled ineligible, kicked off Medicaid because they were drowning in paperwork. What a way to run a country. Here's an example. A waitress with diabetes misses the paperwork deadline because the forms were sent to her old address. She loses her Medicaid coverage and can't access her medications and is forced to miss work to deal with it. One analysis determined that approximately 3 million manufacturing, agricultural, and service sector workers could become uninsured under the simply make sure they're going to work plan. Who thinks that's a good idea? Yesterday, House Republicans spent Mother's Day scheming on how to advance these Medicaid cuts, finally releasing a copy of their legislation so we can see the detail. It's as catastrophic as we feared. It is the largest cut in Medicaid in the nation's health history, ripping health insurance away from millions of Americans in every single state. But it's not too late for a few Republicans, and it only takes a few, 4 in the House, 4 in the Senate, to step up and say they don't want to be part of this. If they will stand up and say no, we will not risk the health care for millions of Americans as bargaining chips for billionaire tax breaks. Medicaid provides health insurance for 1 out of every 4 people in my state of Illinois, 3.4 million people, including 1.5 million children. Medicaid pays to deliver half of all the babies in my state, half of them. 2/3 of the seniors in nursing homes depend on Medicaid. If Medicaid is not helping to pay for that nursing home or care for seniors, what's going to happen to grandma, grandfathers, those that are affected by it? It's the largest funder of opioid addiction treatment. Remember the image of Elon Musk, the richest man in the world, laughing gleefully as he danced around a stage with a chainsaw in his hand? The richest man in the world was laughing out loud about his chainsaw cuts to Medicaid. Well, these cuts are no laughing matter for that rural hospital worrying about having to close its mental health services. They're no laughing matter for the pregnant woman forced to drive more than an hour to deliver her baby because the local hospital shuttered its obstetrics unit. Wipe that smile off your face, Mr. Musk. We're talking about life and death health care for America's working families.